Me?
Boom. All right, cool. Staring at you.
Okay.
All right, good morning or good afternoon if you're an early riser. I'm here to do my refutation speech on something that provides you plenty of sleepless nights, medical marijuana and its benefits. So my refutation speech is for Stacy, who claimed that medical marijuana has many beneficial effects for patients. So let's start off. One of the first things that she brought up was glaucoma, and that medical marijuana helps with that. One of the first things she said was leading cause of blindness is glaucoma. It's actually untrue. AMD, age-related macular degeneration, pretty much old age, is the leading cause of blindness. So medical marijuana would not really be a benefit for that from the start. But for glaucoma, medical marijuana helps with relieving pressure behind the eye, where it is. Sorry. As she had said, it's IOP, interocular pressure, which is what glaucoma is. And marijuana actually helps by opening up the blood vessels to help relieve that pressure. But with that, it also comes with many many harmful effects. Sorry. So let's start with why the FDA hasn't even touched medical marijuana for the most part. Why it's not FDA approved. To be considered a legitimate medicine by the FDA, U.S. Food and Drug Administration, a substance must be well-defined and measurable in ingredients. Each plant is different, has different chemical buildups, could be more THC, could be more, pretty much any of its factors. So it's hard to regulate that in just the start of that. So, so the plant is typically digested. Let's start with the beneficial part of it is the THC that's actually in it. It's not the other things in it, it's the THC. It's supposed to help a lot of different things. So studies have shown that THC is a neurotoxin. A neurotoxin is a substance that damages or impairs the functions of nerve tissue. So the benefits claimed by proponents of medical marijuana include nausea due to cancer, chemotherapy, and reduction of inocular disease, glaucoma. However, approved and effective medications to relieve these symptoms are already out there that aren't medical marijuana. There's an approved drug called Marinol that isn't smoked, which contains synthetic THC and can be taken in more controllable doses. So there's actually something out there that contains pretty much THC that's more controllable, but it's kind of pushed aside. The main reason that medical marijuana is being pushed for medical reasons is because people want to use it for recreational. So let me give you some of the harmful effects of why medical marijuana does not have beneficial effects, because it actually harms you more than it helps you. Ingested THC acts on specific molecular targets on brain cells called cannabinoid receptors. These receptors are abnormally activated by a chemical similar to THC, but not THC. So normally your body actually gets these chemicals on the normal, and so it normally has its own levels. Well, by taking THC, you are overreacting these cannabinoid receptors, and which is what causes the euphoric feeling and the high that you get. So the effects that it influences pleasure, memory, thinking, sensory, time perception, judgment skills. All these are changed when you smoke. So first off, if you're going to take this for a medical reason, if you smoke, you can't operate a vehicle, you can't make correct judgments, so you can't take this and go to work. At least you shouldn't. It's harmful to the lungs. Let's talk about that. A little bit of, so anything that you smoke is obviously harmful to your lungs. You're burning material, and it's going to your lungs is harmful. So medical marijuana is frequent. I'm sorry. Medical marijuana has some respiratory problems associated with tobacco smokers, such as daily cough, phlegm production, acute chest illness, and a heightened risk of lung infections. And cancer risks have not been adequately studied long enough to prove that they were harmful from medical marijuana use, but it also didn't prove that medical marijuana use helped prevent that. So it didn't go either way. There hasn't been enough study on it. Also, another thing with the FDA is still working on. Heart risk. So associated with heart risk, also insomnia. Medical marijuana is supposed to help with insomnia. It's supposed to help put you to sleep. Well, contradict that. Medical marijuana raises your heart rate by 28 to 100% shortly after smoking. So you're not going to go to sleep after smoking. Like, I mean, and the effects can last up to 3 hours. In one estimated study, a 4.8-fold increase on risk of heart attack for individuals after smoking weed. Let's see. All right, and then contrary, let's go to addiction, which is something you probably don't believe with medical marijuana. There is actually an addiction factor with it. Just like almost anything, you can abuse it with alcohol, medical marijuana. So addiction, let's read off some of these percents. 9% of users become addicted to medical marijuana, and then of the medical marijuana users, people that start at a young age are normally 1 in 6, or about 17%. Among people that smoke it every day are 25 to 50% on the addictive. It's hard for them to quit. When they do quit, they have loss in appetite, insomnia, and several other factors that lead to this addiction. So, like I said, medical marijuana may have some good effects, but it is outweighed by its harmful effects. And it should be more of a recreational use is what she should have pushed for in saying that it was legalized. She brought up a lot of medical benefits, but overall I think it would be beneficial for recreational use to provide stimulation to the economy, not in a medical way. Thank you.
Tuesday the 25th is our test, yeah.
Do we have a quiz that Thursday, chapter 11? Or?
No, we'll probably move it around a little bit.
Okay. Just wanted to make sure.
Is there like a study guide for the test or no?
Yeah, there is. I thought I posted it, but if I haven't, I'll make sure I post it for you.
It's not on my gateway.
It should be on my gateway, but I'll post it for you. We talked about it in class the one day. Yeah, last week on Thursday. All right, Patrick, you labeled the topic clearly. I thought you were going to go through the arguments individually. That's what it sounded like you were going to do. But in the end, once you get past the glaucoma issue, it all turns into this kind of more generic argument about the problems with medical marijuana rather than talking about the particular benefits. I don't remember if the advocate mentioned any particular benefits outside of glaucoma, and it seems like if they did, that it would be appropriate for you to respond to them in kind. I thought the glaucoma argument was a little underdeveloped. You, in essence, you're maybe challenging the issue of blindness to some degree. I don't know that they were saying that glaucoma was the major cause of blindness, but it is a cause of blindness. You just basically said the biggest cause of blindness is macular degeneration, which might very well be true. I'm not sure, though, that means that glaucoma doesn't also contribute to blindness. The argument about interocular pressure, you're basically conceding the notion that it has this effect. I know that there's a lot of research that disputes the effect and how consistent it is, and that the glaucoma societies, the medical groups that are associated with treating this, none of them have approved or recommend the use of marijuana as a treatment for interocular pressure, and it seems like that would be information that would be really useful for you on this particular point. The general FDA argument, I think, is a good argument to have in the middle here that says, look, the problem with looking at this from a medical point of view is that you can't control the dosage, it's uncertain as to how much people are having, it's a neurotoxin, so there are particular dangers that are associated with it. I think that that's pretty reasonable. And then you've got some other arguments about the dangers that come along with using it in these cases. That's fine, but it does seem like it's a rebuttal argument that's not particular to any of the benefits that were being cited by the advocate. It's just a general argument about, I say just, it is simply a general argument about the problems with using it as medicine. And I think there are some other issues that you can get into along with that. The explanation about not operating a vehicle and that sort of thing, I think that that's okay, but of course there's a lot of traditional medicines that you're under the same kinds of restrictions, that you're not supposed to be operating a vehicle under. It affects your judgment, it might make you sleepy or distracted, or you have some kind of problem. So what's unique about this in comparison to those other medical treatments, I think that you need some information on that. The other medical dangers that are presented, the heart risk, the lung risk, those are okay. The risk of addiction, I think those are fine. At the end, you've got kind of this irrelevant argument that says what we ought to be arguing about is something different about whether or not it should be used as recreational purposes. And you think that should be a good thing. That's and we could tax people on that. Well, the last four arguments you made right before this was that it's.
I was bringing up her argument.
Yeah, that we've got lung harms, heart risks, addictive behavior. You're kind of suggesting that we ought to be having a different argument about it. I think you've already made an argument that says using this is problematic. Don't try and shift the focus here. Stick to the argument about the medical uses. Is it really a good thing for people who have a medical condition to be taking something that could be addictive to them? Is it really a good thing for them to take something that could increase their risk of lung infection when they are sick? Is it really a good thing for people who have some medical condition that they're trying to treat to take something that's going to increase their heart rate by 25%, quadruple their risk of a heart attack? Those are high risk issues that people who are sick, which is who the advocate is saying people ought to have access to this, say take this, it's good, and we don't even know how effective it is as a treatment. That's I think the way you want to make that comparison. The other thing just feels like it's an irrelevancy. All right, thank you all for your patience. I will post that the study guide right after my next class. I'm sorry, I do it immediately, except I got to get the camera over and.